I'm Dr. Sonia Sasidharan. Today we will be discussing healing of tissue, focusing mainly on healing of skin wounds. Healing is body's response to injury in an attempt to restore normal structure and function. It involves two processes, regeneration and repair. This picture shows the process of regeneration and repair. In minor injuries, there is a healing takes place merely by regeneration of the epithelial cells. If the injury is severe, there will be formation of fibrous tissue and scar formation will occur as a process of wound healing. Regeneration. Here, healing takes place by proliferation of parenchymal cells and usually results in complete restoration of original tissues. The cells of body can be divided into three groups depending on their capacity to divide. First one is labile cells, which continue to multiply throughout life under normal physiological conditions. They remain in cell cycle from one mitosis to the next. Examples are surface epithelial cells of epidermis, alimentary tract, respiratory tract, urinary tract, vagina, cervix, uterine endometrium, and hematopoietic cells. Second type of cells are stable cells. These cells decrease or lose their ability to proliferate after adolescence, but retain the capacity to multiply in response to stimuli. They enter G0 phase but can be stimulated to enter the cell cycle. Examples are parenchymal cells of liver, pancreas, kidney, thyroid, smooth muscle cells, vascular endothelium, bone, cartilage, and fibroblast. Third type of cells are the permanent cells, which lose their ability to proliferate around the time of birth. These are non-dividing cells which have left cell cycle and die following injury. Examples are neurons, skeletal muscles, and cardiac muscles. Repair is the process of replacement of injured tissue by fibrous tissue. It involves two processes, granulation tissue formation and contraction of wound. Granulation tissue is a specialized tissue which is formed in the process of healing of wounds and ulcers. Grossly, it is deep red granular fragile tissue. It is deep red granular due to the presence of uh, many small blood vessels. Microscopically, they consist of fibroblasts, proliferated blood vessels, and inflammatory cells which are composed of lymphocytes, macrophages, and plasma cells. Granulation tissue formation occurs through three phases: phase of inflammation, phase of clearance, and phase of ingrowth of granulation tissue. In the phase of inflammation, inflammation follows an injury with the exudation of plasma, neutrophils, and monocytes. In the phase of clearance, combination of proteolytic enzymes, neutrophils, dead tissue cells, and macrophages clear off the necrotic tissue, debris, and red blood cells from the wound. In the third phase of ingrowth of granulation tissue, there is angiogenesis and fibrogenesis. Angiogenesis is the formation of new blood vessels, which is also known as neovascularization. Fibrogenesis is the formation of fibrous tissue. This is a diagram showing the granulation tissue, and this is the actual photograph of the microscopic appearance of a granulation tissue. We can see there are many small blood vessels, inflammatory cells, and fibroblasts in this picture. Angiogenesis is the proliferation of blood vessels. Here there is proliferation of endothelial cells from the margins of severed blood vessels to form solid bulk which develop lumen and carry blood. It takes place under the influence of many growth factors like vascular endothelial growth factor, platelet-derived growth factor, etc. In fibrogenesis, there is formation of new fibroblast, which is known as myofibroblast, which has the properties of fibroblast and the sport muscles. That is, they can contract. The collagen fibrils will be laid down by the fibroblast by day 6. As maturation proceeds, more and more collagen is being produced, and the number of active fibroblasts and new blood vessels decreases, and there will be scar formation. This picture shows the mechanism of fibrosis. Persistent tissue injury can lead to chronic inflammation and loss of tissue architecture. The cytokines, which are produced by the macrophages and other leukocytes, stimulate the migration and proliferation of fibroblasts, the myofibroblast, and deposition of collagen and other extracellular matrix protein. The net result is the formation of normal tissue by fibrosis. Now we will be seeing how healing occurs in a skin wound. It is actually a combination of regeneration and repair and is accomplished by one of the following ways: healing by first intention or primary union, and healing by second intention or secondary union. Healing by first intention or primary union, it occurs in healing of wound with the following characteristics: clean and uninfected wound, surgically incised wounds, wounds without much loss of cells and tissues, and wounds in which the edges of the wound is approximated by surgical sutures. Sequence of events in primary union: there will be initial hemorrhage, that is, immediately after the injury, the blood fills space between the approximated surface of the inside wound and forms a clot. This seals the wound from dehydration and infection. Second is an acute inflammatory response. In the first 24 hours, neutrophils appear from the margins of the incision, which is replaced by macrophages by day 3. Third is epithelial changes. The basal epithelial cells of the epidermis from both cut margins of the wound proliferate and migrate to the incisional space, which is known as the epithelial spur. The migrated epithelium separates the underlying dermis from the overlying necrotic material and clot, which forms the scab and is cast out. A multi-layered epithelium is formed by day 5. Fourth process is known as organization. This is the laying down of fibroblasts. By day 3, fibroblasts invade the wound. By day 5, it will start laying down collagen fibrils. And in 4 weeks, a scar tissue with a scanty cellularity and vascular lineaments will be formed. Now, about suture tracts. The suture tracts act as separate wound and is healed by primary intention itself. And the suture is removed by day 7. The epithelial suture tract is avulsed and rest will be absorbed. This is a diagrammatic representation of healing occurring by primary intention. Now, healing by second intention or secondary union. It is defined as healing of wound by the following characteristics: open wound with a large tissue defect, at times infected, wounds having excessive loss of cells and tissue, wound which is not approximated by surgical sutures and which is left open. Sequence of events in secondary union. is similar to that in primary union. That is, there will be an initial hemorrhage forming a clot which fills the gap in the wound. Inflammatory phase is there where there will be initial infiltration by neutrophils, later by macrophages, and epithelial changes will also occur. That is, epidermal cells, basal epithelial cells from the both the margins of the wound will proliferate and migrate to the middle of the wound, forming an epithelial spur. But they themselves cannot fill the gap formed by the wound. So, granulation tissue from the base start filling the wound space. This separates the underlying viable tissue from overlying necrotic tissue or scab, which is cast off. So, the main difference between the healing by primary union and healing by secondary union is the formation of granulation tissue. Granulation tissue form a main bulk in the secondary healing. And as you all know, it is composed of fibroblast and the new vessels. The scar tissue which is formed will be pale and white on maturation due to increase in collagen and decrease in vascularity. Another main point in secondary wound healing is wound contraction, which occurs due to the action of myofibroblasts. So this picture shows the wound healing occurring through secondary union. So we will see the main points which differentiate a primary union and a secondary union. Primary union occurs in clean, uninfected uh, wound with surgically clean margins and often sutured wounds. Secondary union occurs in unclean, infected uh, wounds with irregular margins which are not sutured. In primary union, there is only scanty granulation tissue formation, while in secondary union, exuberant granulation tissue will fill the gap between the wounds. The outcome of a primary union is neat linear scar, and in secondary union, a contractile irregular scar is formed. Complications are less common in primary union. Main complication seen is an epidermal inclusion cyst, which occurs when the epithelial or epidermal lining persists in the suture tract. Secondary union is often associated with many complications like infection, separation, etc. Complications of wound healing includes infection of the wound, formation of epidermal cyst, hyperpigmentation, deficient scar formation, incisional hernia, hypertrophied scar and keloid formation, excessive wound contraction, and neoplasia. These pictures shows a hypertrophied scar and keloid. This picture shows another complication of wound healing, that is excessive contraction causing deformity. This type of excessive contraction is mainly seen in healing of burns. Factors influencing wound healing can be divided into local factors and systemic factors. Local factors include infection, poor blood supply, foreign bodies, and movement, which can all delay wound healing. Ionizing radiation can also delay wound healing as it delays granulation tissue formation, while UV exposure can facilitate wound healing. Wound healing also depends on the type, size, and location of injury. If the size of the wound is larger, it takes time to heal, while if the wound occurs at the place where there is increased chance of movement, like in joints and all, uh, the wound healing process will be delayed. And if it occurs with the areas of increased blood supply, like perineal area, a scalp, etc., the healing will take faster. Systemic factors include age. There will be rapid wound healing in younger age. Nutritional factors like deficiency of proteins, vitamin A, C, zinc can delay wound healing. Systemic infection and administration of glucocorticoids can also delay wound healing. Uncontrolled diabetes mellitus and hematological abnormalities like effective neutrophil function, neutropenia, and bleeding disorders can also delay wound healing. So, before we conclude, the main points to be remembered are healing occurs mainly through two processes, regeneration as well as repair. When we come to healing of skin wounds, both these processes, that is regeneration as well as repair, plays an important role. Skin wound healing can be of two types, healing by first intention or primary union and healing by second intention or secondary union. Primary union occurs in wounds which are clean, uninfected, sutured wounds and in surgically incised wound, while secondary union occurs in large wounds which are left open, which are infected, or which has much loss of cells and tissue. The main difference between the healing of both these types of wounds are in secondary union, granulation tissue formation plays an important role. Here there is formation of exuberant granulation tissue and it will be associated with the wound contraction, while very less amount of granulation tissue is formed in healing by primary intention. And we have also seen some of the complications associated with the wound healing as well as factors affecting wound healing. So we will be concluding the session. Thank you.